Let's discuss incision and scar management. So to be clear, and just to reiterate, one of our biggest fears when we're working with someone after a surgery is that they're gonna play with the scar before it's healed, play with that incision before it's healed, and we're gonna get infected. So we spray it, we wash our hands, we keep it dressed, all of those things, but eventually, there's going to become a time where we need to talk about this. So if we look at my own incision on my knee, there's a couple things that we want to talk about here. And I'll use this as an example. So I'm about 14 months out here from having a total knee arthroplasty or knee replacement after a horrific ski crash. And when we're looking at the knee itself and the scar tissue, I shouldn't see changes in my skin. So you notice that my skin is ultimately, I can roll it here, and my scar isn't adhered down to any of the subsurfaces. So inside, I've got other sort of incisions, but the superficial incision through the system as it heals basically creates a vertical wall. And what ends up happening is if I end up tacking this down, I'm gonna have some tissue that doesn't slide and glide very well. Most people that we work with are actually really afraid to touch their incisions. So when I say don't play with your incision if it's not healed, that doesn't mean I can't come in and start rubbing and putting some input into here. Even grabbing a towel or a shirt and just getting those tissues sliding can make it feel much better and begin to tell your body we're gonna be getting a lot of motion here. The problem with scarring or the problem with incisions is that if we're not loading the tissues along the lines of force, then that collagen actually doesn't get any of the signaling about how to organize. And what we tend to see is scars tend to be highly disorganized collagen bundles that don't sort of transmit energy very well. It's like a knot in a piece of wood. And what we're trying to do is make sure that as I get movement, that I'm getting these tissues sliding. And you can always compare it to your well side, a non-surgical side. And I probably have even a little bit more tissue movement on this side because I've put so much energy into here. So first order of business is, hey, if I have a scar or an incision that's healing, I can begin to mobilize the areas around the scar. And your physical therapist and rehab person, hopefully they're teaching you how to do this, but chances are they may not have a lot of time, or they may not be able to be in your home 7 days a week where you can begin to work on this tissue yourself. So being able to access it, get it to slide and glide is a big deal. Once the incision is closed, I can come on top and start to push side to side. Scars, incisions love this gentle side to side motion. And ultimately, it doesn't matter which direction or vector I push, I should have free motion in all directions. So if I'm pulling on something in one direction, it feels fine. If I take all the slack out of the system, you can see it just doesn't slide. That would be a problem. And then another direction I have motion, then I want to start to make sure that I'm thinking about that tissue in that motion. So 360-degree slidability in these tissues is the game. Once I got that incision closed, I can take my thumbs on top and start to move side to side. And again, once it starts to feel irritated or you feel like you just had a dose, that's enough. The goal here is to have constant exposure and even just tell my brain, it's okay to touch my leg. There's a lot of people who they don't want to look at their knee, they don't talk their knee, they don't talk their elbow, they don't talk to their shoulder. And so making sure that the skin slides is a big deal. We have a couple other tools available to us. One is that we can use this GuaSha. This could be a butter knife. It can be a spatula. And I can begin to do some light scraping in and around the area. So I just hold it at a 45-degree angle, and I'm just kind of scraping that system to get those tissues to slide. This is really a wonderful way to desensitize tissues, but to come in and around and just make sure that the tissues are articulating appropriately. It's a wonderful way to get in here and even do some detailed work with the tip of the butter knife, not even the sharp end, but the handle end, where I can make sure that the skin is actually moving in these areas. So GuaSha can be a wonderful way to bring some blood flow back into areas. And again, I just scrape in one direction. I can turn and scrape the other direction. I don't need to go super hard, but I am interested in some motion. And usually 30 seconds to a minute is more than enough. keeping this handy by the TV. Again, what's our intention here? To restore how these tissues slide and glide, and to get some input to improve blood flow. That seems very reasonable. And that leads us to cupping. So this is a simple silicone cup that you can get literally on Amazon, these sets. And what's great about these is you can see how much motion I can get in the tissues. So I just load it up, boom, and I'm not even on my scar, but look at all the rotation I can suddenly get. I can get right in there and twist. You can put a little lotion on here and get a bigger grip. But this allows me to get a little bit more shearing forces in the whole system, and it's easier to add rotation. I can also get a grip here and start to do some sliding and gliding. And then if you wanted to, on Amazon, this is just a simple cupping set from our friends at Cup Therapy. But one of the reasons we like cupping is it's an easy way to change some of the fluid dynamics. Everything that we do is compress, compress, compress. And suddenly if I can decompress, pull those tissues, it gives me an opportunity to recreate motion in the joint. So this is a little simple system. Most cupping kits are like 20 bucks on Amazon. I have this automatic pump, but I can be getting this right on my scar itself. And I love to keep the pump on. And then this, again, allows me to have access to a lot of tissue slide and glide. Once this is healed, I like to keep the pump on. I get a little bump in here, and then I can be adding in that motion and in that slide and glide, and I can get a lot of work done. I can also begin to add in motion and twisting and just loading up the tissues a little bit different way. This is super benign, easy to apply, and again, let me just say that after playing with all of the various pumps, I love this consistent pressure here. But if you popped it off, it still stays there. The simple rule of thumb with a cup is that you leave it on maybe for 5 minutes or 2 or 3 minutes, and you let just some tissue and blood start to form, and then you start to play and move. But in this situation, since we're talking about sort of the whole system, but more importantly, we're talking about the mobilization of the tissue that might be stuck, I'm using it as a different way to create grip and slide and glide. So all three of these fall into sort of the same category in my brain of how can I make sure that my incision doesn't come back to haunt me, that I have tissue layers that are moving and that I don't put a stitch or a tack or a staple right in the middle of one of my movement systems. That scar management ultimately is your responsibility, and what we want to do is make sure that I'm on it early. Again, if it's irritated, if it's red hot, if it's open, we don't mess with it, we keep it clean, we can work in the areas around it, and as soon as it's moving, I can gently begin to mobilize that using various tools. Hopefully that helps.